Welcome to our Conflict in Healthcare Talk Story series today. My name is José Barzola from the Matsunaga Institute for Peace at the University of Hawaii at Manoa. Our talk story today will focus on community health work in Native Hawaiian and Pacific Island communities with Meetu Kelen and Dr.Lee-Ann Heely-Rolston. Thank you for joining us to learn about compassion, innovation, and trust. Today's event will be live streamed on our community Facebook pages through the 100 Infantry Battalion Veterans Education Center, aka Club 100, Seeds of Peace, KTOH Honolulu, and the Spark and Matsunaga Institute for Peace and Conflict Resolution. Join us today to learn about the innovation and collaboration that has emerged through COVID-19 to support Native Hawaiian Pacific Island communities in West Hawaii on Hawaii Island. This event is co-sponsored with West Hawaii Community Health Center. We're going to start today by introducing our special guest. Meetu Kelen is the community health worker for the West Hawaii Community Health Center. She graduated from Fiji National University School of Dentistry and used to be a dentist in the Marshall Islands from 2003 to 2016. Meetu is a mother of three. Her passions are around advocating for community and service to others, as well as to change the negative stigma about Native Hawaiian and Pacific Islands, also known as NHPI communities. This has recently led her to community leadership to advance women's leaders in the Marshallese community. Dr. Lee-Ann Heely-Rolston is the Director of Innovation and Transformation at West Hawaii Community Health Center. She is a graduate from Kamehameha Schools, holds a Master's of Education in Vocational and Rehabilitation Counseling, and a Doctor of Management and Organizational Leadership. Lee-Ann serves as Board of Director for Vibrant Hawaii, the Chair of the Going Home Health and Housing Committee, and a member of the Hawaii Community College Chancellor's Advisory Council. Her passions include creating environments of health and wellness, empowering and advocating for marginalized groups in areas of peace, leadership development, equity, and inclusion. And to get us started, I'm going to turn it over to our good old friend, Dr. Lee-Ann Heely-Rolston. Thank you again.
Mahalo nui for that warm, beautiful welcome, Jose and your Hui and team over at the Matsunaga Institute for Peace. Meetu and I are so blessed to be here on this beautiful Aloha Friday. Aloha. Welcome everyone. Aloha mai kako. I see all the waving. Thank you so much. We are honored here to be here today to spend some time to talk specifically about the beautiful work that's being done and some challenges too in community health. We come to you from Hawaii Island, the West Hawaii community. And at this time, I'm going to go ahead and share my screen. Just for the sake of time, we have you folks till 2 o'clock, but we will stop short about 1:40 and share. We'll talk story, Q&A. And let me know, folks. Thumbs up. Screen is good? All right, I see beautiful smiles and thumbs up. So welcome. We're so blessed, as I shared, to be here with you all. And let's see here. So West Hawaii Community Health Center, just a little bit about who we are. I'm seeing names on here that we work with quite a few of you, so it's wonderful to see you, friends. The mission of West Hawaii Community Health Center, we offer quality, comprehensive, and integrated health services accessible to all who pass through our doors, regardless of their ability to pay. We promote improved health and well-being through ho'olakino, and we look at that as the healing of individuals, of families, and most importantly, communities. Our vision is to live in a healthy community, woven like lauhala, nurtured by strong, productive individuals and families, u'amau. We look at this, and we have often spoke at the Center for Planning, as many of you know, for the 7 generations in our future. So preparation for the 7 generations ahead. And I'd like to also mention that we are a federally qualified health center. And so the fact that we offer care to anyone who passes through our doors, regardless of their ability to pay, is very key, because if somebody doesn't have the financial means, we will still provide that quality care, which is very important. Okay, Meetu.
Aloha, yakwe, everybody.
Yakwe.
I'm honored to be here too. So going on to the next slide, we want to share the values that we have here at West Hawaii Community Health Center. So all the staffs working with West Hawaii Community Health Center, we try to provide services, even though we're working out in the community or even when our patients are here in our clinics. And these are the values that we try to portray in the service that we provide. And as you can see, we used to have about 8 or more values, but it's just recently been narrowed down and focused more on 4, as you can see. And the first one that we have on the slide is Ho'ihi, which is integrity, aloha, respect, kakoho, advocacy, and hohana, compassion. So at West Hawaii Community Health Center, we try to do the service, whatever we do, we make sure that all these values you can see in the service that we provide.
Beautiful. Thank you so much, Meetu. Here are some of the vulnerable populations that we work with. We do see approximately 17,900 patients, I think was our last report. And we focus specifically around groups that are in need with their vulnerable situations. Native Hawaiian Pacific Islanders is, of course, near and dear to my heart and Metu's heart. I'm Native Hawaiian, mixed with Chinese and Scottish. So born and raised here, it is my kuleana to care for and serve. We also serve migrant farmers. In Hawaii Island, we have the opportunity to work with individuals who come from faraway places to help with our agricultural work to keep what we've been known for alive. And so we're very grateful for that. But in doing so, we recognize these individuals as individuals that are in need of access to healthcare. So we facilitate that with our team of community health workers. We also serve homeless or at risk of being homeless. This involves youth as well. So we do have an outreach department consisting of 6 individuals that are on my amazing team providing support and kāko'o for our youth. Justice-involved individuals, yes, a lot of our statistics show, of course, that our Native Hawaiian Pacific Islanders rank highest among those statistics that we see. And so we aim to serve those that are reintegrating back into community. And so for that, we are being mindful and recognizing the gaps, the pukas, if you will, and the areas where we can improve upon. LGBTQ plus is another vulnerable population that we work very closely with Hawaii Island AIDS Foundation, the executive director, Peter Tui and his ohana over there, and of course our kupuna. So yes, from keiki to kupuna, friends, we are happy to serve. Go ahead, Meetu.
As you can see on this slide, we in here at West Hawaii Community Health Center, we know that health is shaped by the conditions we live in. And in public health, they call that social determinants of health. So we work with the social determinant of health to support our patients and our community. And as Dr. Lee mentioned, we work with the most vulnerable population. And so it's unfortunate. I mean, most of the people that we work with have challenges with all the social determinant of health. And in order for somebody to have good health, we need to address these. And so although there are a number of challenges that can lead to conflict, we know at West Hawaii that there's such great need, but little support and resources that are available here on the island. And so we try as much as we can to support and be able to serve this vulnerable population.
Thank you, Meetu. Yes, so just sharing a little bit more about our diverse background. So, you know, Hawaii Island, the statistics show that specific to our Native Hawaiian population, we have a 35.3% according to the Hawaii Population Characteristics data of 2019. We have a large group and many needs across the group. We also have our COFA population, Compactor Free Association, 35.5% in Hawaii County. This is the highest percentage across the state. So we have a lot of kuleana, and our team at West Hawaii Community Health Center with our outreach department, we are small in numbers, but mighty with aloha and our gifts to serve. And so we try our best to divide and conquer. These are some, this is some information above that speaks to the diversity. So specific to West Hawaii Community, we service an 80-mile range from Ocean View all the way up past Waikoloa. And that provides us with a beautiful opportunity to reach out and provide service. But like Meetu just referenced, we lack resources. And so often that makes it difficult. We have to think outside the box. We have to work smart in the sense of, taking care of self so that we can take care of others. And just to see the breakdown here, our largest percentage of our COFA population, specific to the Federated States of Micronesia, we have 4 groups. Kosrae is the largest in numbers. We've been working with pastoral leadership with Kosrae community, about 1,200 individuals living in West Hawaii. And Marshallese Community, we've been blessed, like Meetu has shared. She's a community health worker at heart. And so she's often very involved beyond the work hours of West Hawaii Community Health Center hours of operation. Her work never stops. And so she's a blessing to our communities here, not only for her Marshallese community, but all of West Hawaii community. So we have many needs, which limited in resources causes some area for concern, for exciting discussion on how are we going to meet the needs of many. And so I'd like to share with you all a group. Many of you are familiar with APTCHO, the Association of Asian Pacific Community Health Organization. This established group as of 1987 primarily is created to serve our Native Hawaiian and other Pacific Island, as shown here. Many of us on this call, if not all of us, know the high rates of diabetes and hypertension that we face. And so add COVID, add a pandemic onto the already existing challenges. It's caused some exciting discussion. It's caused us to reprioritize, to shift in how we do the work, all the while being mindful about the safety and consideration for our entire community. And through those exciting conversations, we often find ourselves in situations where they're difficult conversations to have, very difficult conversations to have. One example comes to mind that I'll share with all of you. Soon after COVID hit, we were looking on the internet and with various CDC and other state resources, county resources. I could not locate, we have now located, but in the month of March, I was looking for materials in Kosraean so that I might be able to share that with the pastoral leaders. So again, thinking outside the box, knowing that our community needs assistance, I decided, all right, this is it. We're gonna call Kosrae Community Health Center in Kosrae to introduce, to ho'olauna, introduce myself to ho'olohe, to listen about the resources and to really explore solutions. And so the platform that we stand upon at West Hawaii Community Health Center, specifically in my department with our team, is through the Seeds of Peace Foundation, providing us with the 7 research shows, thanks to Dr. Maya, Dr. Carrie Scott, Executive Director. These 7 seeds, all beginning with the letter C, are critical and essential to navigating conflicting situations, to navigating peaceful conversations. Peace is difficult because we have to navigate. So critical thinking, we must be courageous. We have to act with compassion in order to resolve conflict. We have a commitment, right? We have a commitment to reach out, to collaborate, to put our differences aside and to look at our strengths, where we align, and to connect. And so we have seen this transpiring throughout the past few months, throughout COVID, but as community health workers and community health center, it feels as if we've been doing this work for quite some time in preparation for a pandemic. We still don't have all the answers, but last thing I'd like to reference on this particular slide. So you see the self, others, and community. The self, we must think critically and act courageously with self in order to work with others, taking our compassion and our idea to resolve conflict, then broadening that, right? This is a socioeconomic model, individual, others, and the broad community or world, following through with our commitments, our collaboration, and our connection. Now, I'd like to share a little bit of just a little bit of some of the challenges that we quickly endured as COVID was unfolding and impacting all of our communities and changing our lives. We noticed very early on, as I referenced in the story and the example of lacking materials specific to languages that would assist in sharing the important safety protocols, guidelines, regulations, steps to taking care of oneself in order to take care of others, in order to take care of community. We have already endured existing stigma as Native Hawaiian Pacific Islander groups. We have endured this stigma of being marginalized, of having others, speak in a way that has been disrespectful, having data that may not best represent our beautiful groups here, which we are all working on to take a better look at the data so that we can better serve our communities. The limiting resources we have as a federally qualified health center, we're limited. We run on grant programs and projects and donations and volunteers, so that becomes taxing. It causes room for creative, exciting discussion on how we will meet the needs, because meeting the needs is never a question. We will meet the needs, but it's how we will do that. It's how we will do that. We didn't have in place the various task forces that we all have come to know and some to be a part of and others lead. So these were challenging times as COVID was unfolding. The various state groups that we now have in place to provide kāko'o, we didn't have as organized as COVID emerged in the months of February and March. And then our county groups, similar. So looking back, were we as organized? Probably not. But as we all know, with challenge comes opportunity. And I've witnessed day by day, our teams, our organizations, our partners establish themselves, organize themselves, collaborate, communicate. And that's been a beautiful opportunity to address some of these challenges. And the last point I'll share on this particular side, I'm excited for the future conversations specific to the kāko'o support and opportunity for our Native Hawaiian Pacific Island groups. A lot of healthy conversations have come as a result of the pandemic. And I believe there's more to come in the future, which will drive solutions in caring for a thriving Hawaii. Meetu, I'll go ahead and let you share about this particular slide.
Thank you. So with challenges that Dr. Lee have mentioned and shared with us, although back in March, West Hawaii Community Health Center knows that we serve a lot of vulnerable population. And so there was a lot of transformation happening at our clinic. And it's not just within the clinicians, it happens all part of the different departments. And so we know that we cannot close our clinic, because if we close, who will be serving the vulnerable population? So there was a lot of things that happening. And as you can see here in the pictures, we're sharing that in March 16, that's when our clinic set up a testing site outside our clinic. And that's open to everybody, mostly our patients. And so not just the clinics, even with our outreach department, we have to revamp all our resources towards the needs, because although West Hawaii Community Health Center have been serving and doing what they're good at serving people, although prior to the pandemic, when pandemic came, there was no change. It's just the way how we approach and how we serve, just depending on the needs at that time, which is the pandemic. And so even I remember back then that a lot of people were laid off and a lot of people were like, scared. There was confusions, and especially within the population that I work with, where there lack of information. And so we feel that as a outreach, as a community health worker, we take upon us that new responsibility. Although I'm constantly scared that I'll be able to, if I get infected, I have 2 kids at home, and I'll be able to be like, taking the infection back at home. But I disregard that thinking, because if it's not me or if it's not my team, who else should be serving our vulnerable population? Because we all know that with this COVID-19, it doesn't need pharmaceutical treatment. It just needs some form of like masking, social distancing, good hygiene. So we need to share this information and message to our population. And who, if it's not us doing it, who else will be doing it here at the West Hawaii? I mean, a lot of we have a great amount of patients that depend on us, on the service that we have. And I'm proud to be part of the West Hawaii Community Health Center team, because we did not close our doors since the beginning of the pandemic until today. Although the numbers were like going up and a lot of people were like scared, and I know some of the places were shut down, but I'm so proud to be part of the team that put the people and the community first before ourselves. And so these are some of the transformation that happened. Although we might have canceled appointments, we increased more of telehealth. So we have no choices but to take upon whatever that needs to be done. A lot of different departments like care coordination, the outreach department, medical assistants, we have to learn all about telehealth in order to be able to constantly be serving our people. We don't want to cancel appointments without providing an option that is available. So those are some of the things that happened since the beginning. Next slide, please.
Yes, thank you, Meetu. So room for improvement, some of the challenging conversations. I invite you all to reflect on these headlines that I pulled as I was preparing for today's talk story. These headlines represent some of the challenging experiences that we have had amongst the Native Hawaiian Pacific Island groups. The far left, DOH apologizes for director's comments about race and ethnicity prior to the remarks made specifically to the Marshallese community, made about the Marshallese community in Kona. There was no race mentioned, and so this was very hurtful. And Meetu and her husband, Charles Kelen, outside of West Hawaii Community Health Center, they serve as leaders in the Marshallese community and Big Island Marshallese Community Association, as well as the Marshallese Women Leaders Group, Wudajippo, meaning one heart, one aim, one goal. They organized a response to the statement that was made. And these are ways that that community has responded to some of the not so nice statements that have been shared publicly in media. The middle highlights an article that we were familiar with in Civil Beat. DOH says Native Hawaiians have a high COVID rate, but how high? Many of you recall that data was lumped together. So here we have a picture. Esther Kia'aina was questioning and exploring, very curious, how can we disaggregate the data so that we have a better look at who's being impacted and how we might be able to better serve, knowing that information. And yes, data may not always be about numbers. We have qualitative data, we have stories, we have lived experiences. And then on the far right, Hawaii hasn't staffed the Office of Health Equity since 2015. This is just a quick reference to some of the challenges that were highlighted and areas where light was shined upon so that we could identify these gaps, and has given us room for opportunity to discuss and to have difficult conversations on how to improve our care for Native Hawaiian Pacific Island groups. Sharing with you all a few of our COVID community outreach. In the upper left, we had a beautiful opportunity to address the digital equity divide and get refurbished computers to our lahui down in Miloli'i through collaboration and partnership. My dear friend Mahina Paishan Dward, in partnership with Lili'uokalani Trust, in partnership with our beautiful friends in West Hawaii. And then in the lower left quadrant there, we were also able to get refurbished computers to the students, the haumana at Ehunui Kaimalino, and they were so blessed to receive. And so as COVID was impacting everybody, schools were also transitioning, moving to online platforms. We recognized a big gap and a need to service and provide resources. In the upper right, blessed to work with Auntie Dora, Tammy, and Shaula at villages of Le'iopua, serving our kupuna. The lower right, we had some beautiful bags of produce. We are servicing 50 kupuna living in that area to provide them with sustenance and healthy food access during these challenging times. Metu is going to go ahead and share the picture on the left. I'd just like to highlight before Metu shares, was taken long before COVID, hence the no masks on the beautiful smiles. But Metu, take it away.
Yeah, so at the far left that you can see, this is, it's kind of funny because this was before the COVID-19 happened, and it has been more like a dream or something to, how should we service my population here in the Marshall, here in corner with the Marshall Islands. So this is just a picture of the Waritibil group leaders, and during this day, this is taken back in February. It was more like an inauguration for them to become officials, that they are leaders for the Corner Marshallese women group. Here in Corner, we have different women groups, but they are all faith-based according to the church. So the goal of having this group was to try to unite everybody, regardless of what church you go to and what island atoll you come from back in the Marshall Islands. So we were hoping to kind of unite everybody and to empower our women to be able to help them with all the challenges that they face in their everyday living here in Hawaii. As we all know that back at home, everything is different. And so we were just hoping that having this group will be able to bring everybody together. So when it's come to whatever challenges, example, like for educations, we want to make sure that the moms, the women's have although the men's are the head of the household, back in the culture with Marshall Islands, women's have become more like advisors. So having this group in place we have different agenda to address with our Marshallese population here in Corner, but then without knowing that COVID would hit us, and they become very instrumental in helping us with our outreach with our community during this pandemic. And the picture in the middle, that's one of the first free mask delivery. It's cloth. Most of the mask was sewn by our women leaders and some of our women members in the community here. And some are donations from Oahu, from our Marshallese friends from Oahu. And also we have another Marshallese community in Hilo that donates sewn masks. And so, because as you guys can remember back when the pandemic hits, when you go to shop, it's hard to find masks. All resources were like limited, there was none. Even clinics were fighting to get all the PPE. So that's how we come up with try to utilize the women leaders and the people in our community to better prepare our people. I mean, if it's not us, who else will be able to be helping them to be able to have masks in following the guidelines and protocols from the county. And we have PIMCA, which is Big Island Marshallese Community Association, members together with the leaders, Dr. Lee, Department of Health, and also Captain Mike and his boss from Hilo from the fire department. They were here just to support our outreach department. And far to the ends, that shows some of the Big Island Marshallese Community Association leaders distributing flyers. And that's happened early, like in in March or April, early, because we know that our people that do not have access, that do not know where to get information about how to protect themselves, you know. So these are some of the outreach that we were involved at the beginning. And we feel that that's what helps prepare our community in knowing what to do in protecting themselves and protecting others. Yeah.
Thank you, Meetu. So here we'd like to just highlight some of what are some solutions that we discovered along the way as COVID emerged, impacting our communities. As Meetu referenced, we leveraged our partnerships with the existing organizations aligned with the West Hawaii Community Health Center. We have 5 locations, so we're blessed to be stretched across a beautiful 80-mile stretch. We deployed messaging using various social media platforms, the first being YouTube, specific to the various languages, so that the barrier of language was not going to be in the way of getting messages of safety, of protocol, of accessing care with telehealth, would provide people an opportunity to get help. We had established a beautiful relationship, thanks to Meetu and Charles, with the Republic of Marshall Island Consulate General, Isabella Silk. Through that partnership, there was the establishment of a statewide COVID-19 task force specific to the Marshallese community. Many other task forces were put into place. We have a specific Native Hawaiian Pacific Island task force. Meetu serves on that. She is our representative to serve. We've also looked at expanding, as I mentioned earlier, partnership and collaboration with Kosrae Community Health Center in the Federated States of Micronesia to support, specific to our West Hawaii community, our vulnerable populations that are looking for solutions and access to care and resources. And of course, we rely upon our many community partners. Much of what you all do, we look to our partners. We have to leverage our strengths in order to serve our most vulnerable in these times of challenge. And that helps to pull everybody through as we move forward. Meetu had an opportunity, and I know we have a few minutes before we're going to wrap up for Q&A, but Meetu had a beautiful opportunity to speak with Hawaii Public Radio, civil beat reporters, in response to some of the challenges that her community was receiving. And that's been a beautiful blessing in disguise, because what this has done is it's given voice to, it's given opportunity to voice about the many needs and about having appropriate conversations, to listen to one another, to find solutions. So Meetu, before we advance, would you like to share anything about your experience with those opportunities?
Yeah, I want to highlight the Marshallese task force that was formed under the supervision of our Consulate General, Isabella Silk. And we're fortunate to have 2 physicians on that committee. We have Dr. Neil Palafox, and we also have Dr. Wilfred Alick, who is a physician at Kaiser Permanente in Hilo, and is Marshallese. And these are the 2 main medical people that the task force looked up to with recommendations and questions in regards, because they understand our people, and so they know what works for them. And so we meet every week since they started in March. I joined lately, I think in April or May, and they're still meeting. And I think this helps us kind of prepare us to be able to know. And especially as things were getting worse in the mainland, as you know, a lot of Pacific Islanders were very affected. And with the fact knowing that COFA citizens and Pacific Islanders are at high risk of contracting the virus because of the pre-existing conditions, as mentioned before, with diabetes, hypertension. And so these are, I found that the task force was really helping a lot in providing a lot of information. And we also have, I want to mention Barbara Tom, who is, although she cannot do much for us here in Oahu, Kona, but she does a lot in Oahu with advocating for the Marshallese people there. And And I also want to acknowledge the Native Hawaiian Pacific Islanders Committee, which I participate in the social support. Although I don't contribute a lot, but just participating and attending the meeting is, I get to learn and learn more, just to get information and resources that are available that we could better serve the needs of our people that we serve here in the West of Hawaii. And then just everybody that have contributed a lot. We have a lot of other agencies here in Kona that have helped the Marshallese people, especially recently now with the numbers been going up. Although the help in the beginning was not available, but just recently in September, we've been communicating with county offices and Department of Health. They're very, I guess they kind of acknowledge us and know that community leaders knows their people, and we connect them in whatever ways we may be able to be helped. Thank you.
Thank you, Meetu. So as we close out here, just to highlight some of the recommendations moving forward, the last two slides, this is taken specifically from APTCHO, and in January of 2020, right before the February breaking in news of COVID here specific to Hawaii. These were recommendations made in a report by APTCHO, and if you look at them, increase capacity for data and research, provide culturally and linguistically appropriate clinical and non-clinical service, explore cross-sector partnerships, improve federal, state, regional, and local relationships. These are recommendations we can be a part of and should be a part of. Meetu and I, in preparation for the closing of this portion of our program, before we open it up to Q&A, we shared, we brainstormed to ask, what are some ideas, what are some takeaways that we'd like to offer our community? Of course, listen. It's a beautiful time to listen, always, to hear. They say communication, the number one skill in communication is to simply listen. Ho'olohe. Translation materials, assessing your communities and organizations to see, in fact, that we are meeting the needs of those who English may not be the primary language. Always show respect to your friends and partners and co-workers and colleagues. Have an awareness, being maka'ala to what is around. Data, here's the data. Again, not just quantifiable data, but the qualitative data. And always being an advocate for those who, for no reason or no fault to their own, may not be able to self-advocate and speak to the challenges and needs. Carry ourselves with the essence of aloha. Many of us, if not all of us, know it's in our law. HRS 5-7.5 is the Aloha Spirit Law. And, remember the compassion that we must have within ourselves as we work during these difficult times with others, and of course, empathy. And so caring for one another. This concludes our last comment here. So I'm going to stop share here and let these two letters, Q&A, mahalo for listening, mahalo for being here. And we are excited to get into this aspect of the talk story to engage with you all.
Thank you so much for that. I just wanted to, first off, so we'll get to some of the questions that came in the chat. We have a great community. Actually, there's a whole class from Kapilani Community College joining us today, so that's wonderful. But one of the questions somebody had, does anyone know if the NHPI, that's the Native Hawaiian Healthcare Systems, has had any input on the response to COVID in the state? Whoever, if you don't, you don't. It's quite okay. Just, it was a question that came from our audience today.
NHPI. I don't have specific data at the moment.
Okay.
We can, if any of our audience members would like to share, if they are a part of, have access to, we welcome you.
So someone actually mentioned Papa Ola Lokahi has been highly involved with many aspects of the response, including the NHPI 3R task force. So
Yes, that's the task force. Meetu, we've had to divide and conquer. Meetu's been blessed to be a part of that. And Meetu, can you share the special committee that you're serving on and some of the conversation around that?
So yeah, so I'm very privileged to be part of the social support committee. And then even within that social support committee, they have a subcommittee for Pacific Islanders. And maybe some of you know there's a concert that will be happening tomorrow. And this is happening from the work that the subcommittee Pacific Islanders have done, and they put a lot of effort. So if you have time, please tune in and watch it. You'll be amazed to see the performances and even some of the PSAs around COVID-19. So it's a campaign. Whereas in social support, the main committee, there's a lot of amazing, talented people on that, which that's why I mentioned that most of the time I might not be able to be contributing, but I've learned a lot. They've taken upon them hoping to really kind of narrow down what are some of the main issues. And then what they come up with, we have like with healthcare, education, housing, mental health issue. There was like about 6, we narrowed down all the challenges. And so it's still a working process, and they're still trying to come up with some of the ideas and issues, and hoping that they'll be able to present to some of the legislative or policy makers to be able to consider some. We know that it's not going to happen now, but that's the work around. That's what they've been doing. That's what I learned attending these committees, to kind of being prepared for them sharing all resources and things and ideas, prevalent ideas that will be able to help Native Hawaiians and Pacific Islanders in the future, not just for this COVID pandemic. So that, unfortunately, I'm not participating in other committees. So that's all I can share from the part that I'm in.
Thank you so much, Meetu. Thank you so much. And I also see here in the chat that work with Maui College is also being done to train community health workers. So this is essential, community health workers. We have been approached, I'll speak to this just briefly. We have been approached as a community health center by various agencies, state and county alike, to connect with community, because that's what we do daily, community health work. And so our state systems, our county governments have recognized the opportunity to partner with and explore through the lens of community health centers how to collaborate and connect with community. Often we say, and I know Meetu have said this, maybe some of you have said this, that we are the eyes and ears of community. And so we are blessed, we know that we are blessed to work beyond the walls of the community health center. So we look at community health as beyond the walls, much more involvement with meeting people, building trust, listening to the needs, hearing the stories. This is essential to increase our community health worker pool statewide, very essential. And so we look to provide those supports and services with our social determinants of health and enabling services that allow people to get the help that they need based on where they're at, where they're struggling, and where they'd like to be. And in terms of Kapiolani Community College that's here on the call today, we thank you, because a few of our workers, a few of our colleagues, one who's been speaking and sharing stories, Meetu, is participating in the community health worker program. So and this was a blessing that again emerged, these silver linings that have created opportunity for people to align their passion with academics and opportunity to then bring it back into community. What a beautiful blessing Meetu, do you want to share your experience about this journey that you're on?
Yes, thank you. I'm very privileged to have the opportunity to become a student. Going back to school after so many years, it's kind of challenging, but I feel the need because working as a community health worker without having a certification or some form of education, academic background, it bothers me. And because I believe in, you know, further educations, but it's just unfortunate that the the system that I came from, it's different from US. So all my credits or whatever papers that I have cannot be credited. So when this was proposed about the community health workers at Kapiolani, I did not hesitate and just applied. And so I'm fortunate to be one of the students, and I've learned a lot. It's kind of an eye-opener for me in when we first started the first course, because so many things that I've been doing, but I did not realize that there's this theory and all other things, code of ethics, and it's kind of widened my knowledge because I've been doing the work, but it's very resourceful and helpful in what I'm doing. I feel like I have a problem with listening, and I want to honor Mark, who was our teacher, our instructor from the beginning, that he constantly keep reminding that you have to listen. And as Dr. Lee, as you can see at the last slide, we have listen. And I think we need to do that more instead of just keep talking and thinking and assuming that we know everything about our community. But I think it's, if you could take the time to listen, then you'll be able to serve the people. Try and see from how they just they see things. So I I I I wanted to share, and for those who were like thinking of taking community health worker, if you're interested of doing this kind of job, it's a good course. So yeah, I just want to say that I learned a lot during my this past month joining this class. Thank you.
Thank you so much, Meetu, for sharing. I'm just looking in the chat here if there are any additional questions. Any questions coming to mind, please engage. We're happy to talk story and share this time with you all.
Lee-Ann, one question I have is, how can we assist, support you, being on different islands or just being on a different part of the island? Yeah, let us know.
That's a beautiful question, Jose. Thank you so much. How can you assist? Just connect, first and foremost, connect and maintain the connection. We have a wonderful team at West Hawaii Community Health Center. We have not been traveling off island like many. Prior to COVID, we were not traveling for any training purposes. So we have been hunkering down, and connection through the various platforms we have, like many of you on today's on this call. We have transitioned our work lives to social media platforms, to Zoom platforms. So connectivity in that way, Jose, would be paramount. I'm going to go ahead and place in the chat here my email address, and then Meetu will go ahead and place hers. But West Hawaii Community Health Center.org is our website. We have a phenomenal marketing team who they take lead on all social media items and activities. We are always looking to partner, explore, connect with platforms that are in alignment with caring for community, offering healthy solutions to care for others. In addition to the social media platforms, we welcome you to share information that you have at your organization and send it our way. We are constantly sharing what we receive. It's like we receive a resource and it just goes back into community. That's been a beautiful process, beautiful makana for everybody. And we participate with Hui Lau Lima here in West Hawaii, started by Uncle Wally Lau many years ago. And we are just so blessed that these nonprofit organizations have stayed the course, strengthened the connection, especially during these challenging times. So thank you, M. Kelen at westhawaiichc.org, L.A. Heely at westhawaiichc.org. We are responsive. We are always looking to partner with programs. As I mentioned earlier, we are funded through grants. And so if there's something that falls in alignment, please reference our mission on the website. If you feel that your organization aligns and you'd like to partner in some way, one great example is I'm working with José and Scott, Seeds of Peace. While based on Oahu, we are able to connect and work in alignment because we are exploring similar areas of passion, similar areas of need for building more resilient, thriving, and peaceful communities. And so I think it's a beautiful opportunity during these challenging times to revisit organizational mission and find out what your colleagues and other neighbors in the professional world stand for. What do they stand for? What does your organization stand for? Can we stand together in unity and move forward, strengthen numbers? And that's also been a learning process for us, discovering potential funders, discovering opportunity. Often it's been a very slim window. Many of us here today have responded to the call for a submission of proposals, requests for proposals, but it's due in 7 days. So find your partners, gather your information, submit the proposal, say a beautiful prayer for great results, and then move forward. It's been an interesting time, Jose, but I would say connection.
No, thank you. Thank you for that. I appreciate that. And I was just thinking, since we have a lot of students on the call, or in the virtual world, I'm still stuck in phone calls here, but do you happen to have internship possibilities that can be done remotely?
Yes, we do. We are actually working, thanks to Kapi'olani Community College. We are having that discussion. It literally just last week, we were having that discussion. I reached out to our Chief of Operations, Dr. Vicki Haynes, to explore this very question. And it had nothing to do, while we are live, it had nothing to do with my team member, Meetu, being enrolled and accepted and pursuing this. I just would like to be full transparency on that. We're always looking for broad opportunity, casting that net wide. And yes, to me, it makes sense. Internship opportunity, for example, community health workers enrolled in the Kapi'olani Community College Community Health Worker course program. We can participate in an internship. Of course, send me the requirements. Yes, I'm hopeful, and I'm very hopeful that it's promising that we will have. I've just got to confirm the start date for that. So if you are interested, though, in all seriousness, please email myself or Meetu, and we'd like to. I see somebody pointing to Hillary. Okay, good. You're on my screen. There's a few pages here, but I see hand movement, and I see. So Hillary, I look forward to your email. Please reach out. We'd like to support the building of a thriving Hawaii. So we are willing to shift and be nimble and flexible and adaptable. Where it may have been in person, we've now got to look at creative platforms, virtual being one of them. Great question, Jose.
Thank you so much. I'm not sure if we have any more questions for our audience, but the emails are posted there. And then if there are any additional questions, you can also just contact us here at the Matsunaga Institute at uhip@hawaii.edu. And I'm happy to forward on the questions to our colleagues and friends here today. But, you know, I just have to say a few words here, if you don't mind. Just want to thank you, Meetu and Lee-Ann, for providing us the opportunity to really learn about your community. I appreciate learning about just how innovative and collaborative just that has emerged through this pandemic to support, you know, Native Hawaiian Pacific Island communities in the West Hawaii Island. And it sounds as though some of those skill sets are definitely being utilized on other islands as well. So that's just wonderful words to hear, and I'm super excited about all this. And so thank you for everything you both are doing just to take care of our communities near and far. And last but not least, I want to thank you all for joining us to today's webinar. We deeply appreciate your interest and support in sitting down at our table to learn about communities near and far through our Conflict in Healthcare Talk Story series. So thank you.